Today's World Mental Health Day, a time to raise awareness, promote education, and advocate against stigma. And to shed some light on the importance of addressing your mental health is the Clinical Director for Pathlight Mood and Anxiety Center, Rebecca VanBebber. Rebecca, thanks for being here.
Thanks for having me.
So today, as I mentioned, is World Mental Health Day, and this year's theme is access to services, mental health in catastrophes and emergencies. So what does that mean to you in practical terms?
You know, we always hope that people are getting access to mental health care before it gets to the crisis, catastrophe, emergency place. So that's seeing a regular mental health practitioner, talking to a primary care physician about mental health. And when it does get to the emergency, that's when we're looking at people who are having thoughts of harming themselves, others, maybe psychosis, anything that would lead someone to seek more emergent mental health care.
Got it, okay. And if it's truly an emergency that you didn't foresee, for example, a fire, a landslide, those kinds of things, and then you're having difficulty coping, is that normal? When does it cross over to not being normal?
It's very normal. Anytime you experience some sort of trauma or something unexpected, something scary, anyone would have a mental health response in response to that. And so seeking mental health in those areas and asking about mental health in those respects. We usually ask about people's physical well-being in an emergency. It's really important to also ask about their mental well-being.
Discussing mental health has actually become pretty mainstream in recent years, but do you see that actually transforming into more people seeking help?
We really have. I think people are more willing to talk about mental health as a regular part of their health journey. So, you hear a lot about physical health, and as mental health is a more mainstream conversation, people are more willing to enact mental health practices like mindfulness or seeing a regular clinician along with their physical health.
Can you shed some light onto some of the trends that you are seeing here in Western Washington in your clinics?
Well, the biggest one we see in Western Washington is weather related, as you might imagine. In the winter months when it's very cold and very rainy, we tend to see more people seeking mental health care because our health is really affected by those colder months. Outside of that, I think trends we're seeing pretty similar to other parts of the country. People having concerns and coming and seeking treatment because of those concerns.
And we've heard that there is rising anxiety and depression in teens and young adults. Specifically, are you seeing that here in Washington as well? Unfortunately,
yes. We're seeing that teens and young adults are having increased anxiety, increased symptoms. But alongside of that, we're seeing that people are more looking for it and more looking to get people access. So teachers are asking questions about mental health. Parents are sitting their teens down and asking about mental health. So while we do see increases in anxiety, we're also seeing more awareness and more willingness for people to have those conversations and get their kids into treatment.
And very quickly, how accessible is mental health care here in our area? And what is the first step someone can take if they're watching this or maybe they know someone who needs some help?
We're really lucky that there's a lot of different mental health facilities in Seattle and the greater Washington. Reaching out to a primary care physician is a great first step. They can provide referrals. Most mental health agencies will do a no-cost assessment with no commitment, and that can be a great way to figure out what's the right level of care, if it's outpatient or if people need more support. And again, if it really is an emergency, going to seek emergency services.
Thank you so much for being here and for your time today. I really appreciate it.
Thank you for having me.